What's next for a baby after discharge from the hospital? Like, when are you going to see the pediatrician again?
So the baby will first see the pediatrician in the office and outside of the hospital about 2 or 3 days on average after being discharged. Some of that depends on how long they were in the hospital. So we know babies that are born vaginally are going to be in the hospital less time than those that are born via C-section, just because moms need a little more time to recover after having the surgery versus the vaginal delivery. Babies that have been monitored in the hospital after C-section for 4 days don't need to be seen quite as soon as those that were only in the hospital for a day or two. But in general, between 2 and 4 days. And the pediatrician, depending on how feeding is going, whether there are jaundice concerns or any other concerns, will help tell you, well, let's see, maybe in 1 day or 2 days versus the longer period. Weekends can get a little tough because not every pediatrician's office is open during the weekend. And if you're discharged on a Thursday, Fridays may be too soon, Mondays may be a little too late, and you and your pediatrician will have to talk and decide what's best for the baby.
So it sounds like it's a little circumstantial, and the pediatrician will communicate that to you when you go home.
Yep.
Call me and make an appointment for
and most pediatricians will give you instructions on how to make that appointment, where to make that appointment, and when to make that appointment. But in general, that newborn visit is within the first few days, and then the babies fall on the well-child schedule, which is at 2 weeks, 2 months, 4 months, and so on. But that first one happens within just a few days.
And having been a new mom myself, I remember I had a ton of questions. I felt like I had to read every single piece of paper that was handed to me in the hospital, even being a nurse, and that I just had to absorb all this information to feel even a little bit confident to go home and care for the baby on my own. And then even when I got home, there were tons of questions. And so I just wanted to throw out there too that I think it's good advice for moms to write down all their non-urgent questions so that when they have a chance to see the pediatrician again, you can pull that list out and be like, okay, these are all the things I've been thinking about, because inevitably you'll get home and think to yourself, I forgot to ask about whatever it was.
Yeah, it's definitely good practice to do that. Keeping track of urine, stool, and writing down those questions are good practice, because the pediatrician's going to ask about all of those, and we want to answer the questions that come up after you've gone home.
Good tip. And is there anything else that they should keep track of?
The paperwork that is sent home with you is substantial, and some of it is more important than others. One of the things that the hospital will tell you about is the newborn screen. So there'll be an envelope with a pink piece of paper that you're supposed to take back to your pediatrician. That's usually not done until 2-week visits, and so it's good to remember it and have it with you when you see the pediatrician, but know that it might not get taken care of until the 2-week visit.
Are there any screenings that are done during the hospital, and what screenings are done later in the office for a baby?
So the screenings that are done for the baby in the hospital usually start at about 24 hours after they've turned that first day after being born. And they include pulse oxygen, so a pulse oximeter that's placed on the baby's hand and feet to make sure that oxygen and blood are getting where they're supposed to be. That's kind of a quick check to see that their heart is working like it should be. We also poke their heel and get some blood that's sent to the state lab to check for more rare genetic diseases that can be acted upon earlier rather than waiting until they have symptoms later. And so those are sent to the lab, or to the state lab. We don't find out those results for a few weeks. If it's something that it pops positive, it'll happen quickly, and the state lab will hunt us down to make sure that we take care of it. But a lot of times it's normal because these are rare diseases, and we don't find out that it's normal for a few weeks. So don't panic if you haven't heard anything about that.
So you'd follow up with the results in the pediatrician's visits
you won't find out about
weeks down the road.
Yeah, you won't find out about that in the nursery.
Okay.
We also check for bilirubin. So at 24 hours or a little later than that, every baby should have a bilirubin tested to see if it's getting too high, too fast, and when we need to check it again, if at all. We do a hearing screen, so babies will have their hearing tested. Not every baby passes that right away, and that's not a reason to panic. Sometimes there's still fluid from the delivery process and from being inside that amniotic sac for such a long time that it takes time to clear. And so the hearing screen will be repeated later to make sure that that's had time to clear and the babies pass. If they don't pass in the hospital, we check again in the outpatient setting to make sure that they do have normal hearing, or if there's anything that we need to do for that.
Well, Dr. Bowles, that information is so helpful. Even if you've had a baby before, maybe you're not aware of all the things that happen behind the scenes, or you just didn't know why things were done the way they were. So thank you so much for spending time with us today. Where can people find you?
So I work in Provo. I work at the Utah Valley Clinic, which is attached to Utah Valley Hospital in Provo. And I work for Intermountain. So any of those searches will lead you to me, or just search for Dr. Austin Bowles.
Awesome. Thank you so much for being with us today again. And if you guys have questions in the future for me, feel free to ask them on our Intermountain Moms Facebook and Instagram pages, and recommend us to your friends and family too.